Hi everyone, thank you for tuning in. My name is Erika and I'm with South Georgia Medical Center, and this is part 3 of a video communication series that we are putting together to help keep the community informed of everything related COVID-19 in South Georgia Medical Center. So today I'm here with President and CEO Mr. Ronald Dean, and we are standing outside the Dasher Memorial Heart Center. Recently we have implemented masking for everyone in the building, and to just better communicate via video, we will be outside performing our interview today. So Mr. Dean, can you provide us an update on everything going on at South Georgia Medical Center?
Thank you, Erika. I can, and it's good to be out of the mask for the time being, but we are social distancing, and that's the right thing to do during these times. As of today, the latest report is 66 cases in the Lowndes County area. We have treated 49 positive cases as inpatients. Now, not all of those are from Lowndes County, as everyone knows. We do accept transfers in from other counties, but what's extremely positive is 19 of those 49 have been discharged to their place of residence, of which we're just thrilled about that. And they are recovering at home. Someone might ask, what is a recovered COVID-19 patient? Well, there are many definitions, and I don't want to add confusion to the situation, but we're looking for something like 7 days without symptoms. And again, these patients we've called, and we're calling each one of our patients to get an update. They are recovering, not recovered. Each one of them have a different story to tell of gratitude, but they're also talking about that they are having, continued fatigue, but they are recovering. And we consider that a very, very positive occurrence for us. 49 inpatients thus far, 19 recovering at their residence.
Absolutely, thank you. I know recently we announced that we have received testing kits for COVID-19 in our laboratory. Can you expand on how we are identifying who we test and using those kits?
Yes, absolutely. So the Cepheid molecular platform is a piece of equipment South Georgia Medical Center has owned for a long time in our comprehensive laboratory setting. Fortunately, Cepheid has been approved by the FDA as a testing platform for COVID-19. Just recently we announced we received the initial batch of 60 testing kits, 10 of which were used this past Friday to validate the testing platform. In other words, we want to make sure that the platform is accurate, and there's a process our laboratorians go through to decide that. They have completed that. We have performed some in-house testing, and it is a game changer, as Dr. Dawson said. The criteria is we're using it with inpatients, and we'll use it with some of the workforce that could be exposed, but right now limited to inpatients that are meeting certain criteria. As we receive more, and we do anticipate receiving many, many more testing kits, we think we'll be able to test more readily, and then we can expand it to our outpatient setting. Everybody's interested in more being tested, and we are too. As a matter of fact, it's been talked about widely here recently, from the governor to I think Washington is talking about it, and we believe in that. So that criteria will loosen up as more testing kits become available. Right now, symptomatic patients receive testing on the outpatient side of the world or direct exposure, and on the inpatient side, it's obviously those that have symptoms requiring inpatient hospitalization.
Perfect. Mr. Dean, I think we're on a month now of dealing with COVID-19. What do you expect to unfold?
It's hard to say, Erika. The state of Georgia is operating on April 26th, as of last night, being the peak for the state. Every community is different. Some communities in southwest Georgia are experiencing large volumes of patients. Others, not as many. What is the common denominator? I'm not sure. Nursing home outbreaks clearly lead to a higher utilization of intensive care beds. There's this idea that there are super spreaders that's beginning to surface. I'm not sure what a super spreader is, and I'm not a scientist. What I am is a realist, and the reality is that it's still out and among us. We are diagnosing positive in our community, maybe not at the rate others are, but they are being diagnosed, and it just tells me that it's here. And until it's gone, we need to maintain our self-awareness, personal responsibility, social distancing, don't touch your face with our hands, wash our hands and keep our surfaces clean, and do that until this thing is taken care of, and who knows when that will be. I'm hopeful over the next 2 to 4 weeks we will have at least our initial wave, if you will, and then we can determine what more comes later. But I don't know that anybody knows. Some in the panhandle of Florida are talking about, it may be June before they see a peak. Others talk about the peak is here now. But I just say to the viewing public, let's be diligent. Let's continue to be determined. Let's be strong about the things we know, and what we know is social distancing absolutely matters. And I want to thank this community for what you're doing in that regard. I notice people who are wearing their masks when they're out in public. I notice people who are keeping a distance. And over Easter, it must have been very challenging for a lot of people not to be with their loved ones, and the hugs and the kisses and all the things that come with that. But y'all have done a great job as a community. This hospital and this staff is trying to prepare for that unknown, and it's just very hard to answer that question.
Mr. Dean, I know you spend a lot of time up on the floors with our nurses, physicians, and frontline employees. How are they doing?
They're strong. They're very resilient. On the outside, they're showing strength like no other team I've worked with, and I can't be more pleased with what they've done to prepare for what they're dealing with right now and what's to come. It's hard on them. They have families at home. This economy is having an impact on their families. They're fearful of what it is that this is going to do to us, not only from a healthcare delivery team and being safe about dealing with COVID, but what is this doing to our community and the economy of all the businesses in the community? So they bring that here, but I can tell you, everyone I talk to, they have a determination about them that I have not seen before. It really is our hour. I believe these people were built for this. I truly believe they are doing remarkable things despite all of the pressures they're feeling about this that may be occurring even outside the workplace. The community delivering the food, tremendous amount of love, outpouring of notes and cards, that inspires this team, and they want to be what you expect them to be, and I think they're doing their very, very best, and it's up to me to make sure they have everything they need so they can be prepared for you when you come here. And I think they would tell you they're prepared and they're ready and they're willing to serve, and I couldn't be more proud of them.
Thank you for tuning in today. We cannot thank you enough for all of your support. Our staff definitely feels it, and they love to hear from you and see all of your wonderful comments. So keep those coming, and stay tuned to our social media sites and our website so that you can stay informed of everything we've got going on. But again, we thank you very much.
Thank you.